The HIP pathway was set up to improve a patient's access earlier in their treatment pathway to options and alternatives to surgery, as well as to improve likely outcomes. Timely access to this information helps patients to participate fully in decisions regarding the most appropriate time for a procedure. The pathway also aims to help patients understand the cause of their condition and the likely outcomes of the available interventions. It ensures that patients who require surgery are appropriately referred and given preoperative care. It also allows patients to fully participate in decisions about their care pathway. By giving patients a structured education programme which explains about the disease, self-management options and the evidence to support this, as well as explaining about hip replacement surgery and its benefits and risks. Giving appropriate prehabilitation has been shown to reduce post-operative recovery times and improve post-operative outcomes. Our education programme aims to ensure that patients who are referred into secondary care are suitable and ready for surgery and properly prepared so as to enjoy the best possible outcomes. It ensures more joined up holistic working between primary care, physiotherapy services and secondary care. The HIP pathway is not just for patients who require surgery. It is for patients who have moderate to severe hip osteoarthritis that can no longer be managed in primary care, but they do not necessarily require surgery now or in the future. Initial management strategies for patients with hip osteoarthritis include reassurance and patient education, weight reduction in patients who are obese, so particularly patients who have a BMI of over 35. These patients should be referred to Live Well Suffolk for more guided dietetic advice. Advise about appropriate walking aids if the patient is not already using them. Guide them on a patient-specific education programme, and you can see the hip osteoarthritic section of the website for more information on this. Advise the patient on cushioned and supportive footwear, as well as advice on medication, which should typically include analgesics and non-steroidal anti-inflammatories. The referral criteria onto the hip osteoarthritic pathway should be hip pain that can no longer be managed with simple analgesia and basic physiotherapy. There should also be X-ray evidence of established hip osteoarthritis. GPs can access the service by handing the patient a self-referral card. The patient can then refer themselves on the internet or over the telephone, and our senior clinicians will triage these directly onto the pathway. We also accept referrals via the NHS e-referral service as well as paper referrals. All hip patients referred into this service will be seen and assessed by a senior physiotherapist within 20 working days of us receiving a referral. The patient will start their programme of care within 3 weeks of their assessment if they are referred to stage 1, which is for conservative management, and if referred to stage 2, which is preparation for surgery, a referral to secondary care is made that same day. Stage 1 is for patients with moderate or established hip osteoarthritis who require conservative management. The patient will either be seen as a 1-to-1 or for 4 1.5-hour group sessions, which will cover the following: general fitness and flexibility, strength and mobility exercises as supported by the NICE guidelines, weight loss and dietary advice, pain control and management including a pain DVD, advice regarding smoking cessation. There is discussion and video footage with expert patients who have been through the process of having hip replacement surgery, as well as discussion regarding equipment and walking aids if required. The patient will then be reassessed on completion of their 4th session to re-evaluate their goals and outcome measures. Their physiotherapist will contact them again at 1 and 3 months after this appointment for a telephone review. You'll be kept informed of their progress throughout the programme of care. The focus of Stage 2 of the HIP pathway is to prepare the patient for surgery and refer them to their chosen secondary care location. They will receive an initial assessment within 3 weeks of us receiving the referral. They will be referred on to secondary care after that initial assessment and receive up to 3 one-to-one sessions in preparation for their operation. You will be informed of what is happening and receive a copy of the orthopaedic referral and where it has been sent. All patients entering the pathway will complete an EQ5D and an Oxford HIP score. This is repeated again once they have been discharged from the service so that we can compare these outcomes. We also use a patient satisfaction survey to gain patient feedback on the service, and the results of this are reported on regularly. Our satisfaction reports have been extremely positive. These are given to all patients on completion of either Stage 1 or 2 of the HIP pathway. The latest report we took from surveys completed between January and May this year highlighted that over 95% of patients were satisfied with the amount of time given to answering all of their questions, as well as the amount of time given to providing information. They reported finding the presentations and handouts extremely useful in backing up their learning and reported feeling more confident with independent exercise at home. When asked if the HIP pathway helped them find relief from their pain or manage their pain better, 80% of patients reported a 50% or more improvement in their pain.